You're watching TV9 News and I'm Prajwal D'Souza. In the last 24 hours, India recorded over 3 lakh COVID-19 cases and more than 2,000 deaths. As the cases are increasing exponentially, hospitals are overwhelmed by patients. An important issue which has been flagged off by several hospitals is regarding the usage and shortage of supplemental oxygen. So what is supplemental oxygen? Supplemental oxygen is also known as oxygen therapy. For both chronic and acute cases, doctors use supplemental oxygen as medical treatment. The supplemental oxygen is given to a patient when his oxygen levels become lower. The oxygen can be delivered to the patient using a special mask and a device called a nasal cannula. When does a COVID-19 patient need supplemental oxygen? Now, for a COVID-19 patient, oxygen therapy or supplemental oxygen is given when they see shortness of breath, which can be the root cause of an underlying acute condition in the lung. In some cases, shortness of breath can even lead to acute respiratory distress syndrome. Here is immunologist Dr Sitesh Roy explaining when a COVID-19 patient should be given supplemental oxygen and what is acute respiratory distress syndrome.
So Prajwal, when an individual has an oxygen level in the normal range, it is generally around 95-96% on room air or higher. When this level drops below 93% to 92 or lower, that is when we would be concerned about that person not having enough oxygen in their body to perform all the functions that their brain, heart and other organs need to do. And that is when it drops below 90% and is when people start feeling shortness of breath. Now, acute respiratory distress syndrome is a condition that is seen due to many different reasons, right from injury and trauma that is very severe to something called sepsis, which is a serious bacterial infection.
What are oxygen saturation levels? Now, oxygen saturation levels determine the amount of oxygen present in your blood. The level of oxygen saturation might help a doctor to determine how healthy a person is. Currently in this pandemic, this terminology is used often and almost by everyone. There are different levels of oxygen saturation in your body. However, reports claim that without having a clear understanding of oxygen levels, some are hoarding supplemental oxygen while some are receiving it even when they do not need it. Here is immunologist Dr. Roy's take on oxygen saturation levels and on what levels supplemental oxygen is required.
As mentioned, when the level of oxygen drops below 92% is where the need for supplemental oxygen arises. Now, interestingly, in the first wave of COVID-19, there were a lot of people who were having what was called happy hypoxia. Their oxygen levels may be 80, 85, and they were not at all in distress. However, in the second wave, we are not seeing that. We are seeing a lot of people who drop below 90, even to 88, 87, and they start feeling breathless. And some people even will feel breathless at the level of 90.
What is a pulse oximeter? Should you use it? A pulse oximeter is a device used to measure the level of oxygen present in your blood. The small device can be clipped to your finger to get a reading on the saturation levels. Now, during the pandemic, many people were using the device to keep a track of their oxygen saturation levels. But is it recommended to use the device at home? How reliable is this device? Here is what immunologist Dr. Roy has to say.
When used correctly, a pulse oximeter is a very useful device in the current COVID pandemic. We normally only recommend physicians or healthcare professionals to use it. But given the shortage of beds and the inability to always get everyone who needs monitoring admitted to a care center, it is very important for people who have individuals with comorbidities, family members who are at high risk. This pulse oximeter, if used correctly, is very reliable. There are few points that would help. One, if the finger that it is placed on is moving too much, the pulse oximeter does not give a very good reading. So you have to have a very steady finger or hand while measuring. Second, especially for ladies, if there's any nail paint, any nail polish on their fingers, then also they will not be able to get a very good reading. You also have to remember that if the finger is not placed properly into the pulse oximeter device, it will not give a very accurate reading. And last and most important, on every pulse oximeter, there is a waveform that is seen, which suggests that there is a steady reading that is being generated. If that waveform is not correctly noted, then the person's pulse oximeter reading is wrong. It has to be used very correctly and used in the proper manner. It can be invaluable along with something called a 3 or 5 minute walk test that a person can do in their house and measure their oxygen before and after it. It can be invaluable in monitoring a person at home.
Does India have a shortage of oxygen? In India, several hospitals across Delhi and Noida have reported a shortage of medical oxygen. States like Rajasthan were holding up the oxygen supply due to a fear of shortage. Even Madhya Pradesh and Uttar Pradesh have reported a shortage of oxygen supply among several other states. We are seeing a resurgence of COVID-19 and the cases are being reported in larger numbers compared to the first wave of the pandemic. Now it is up to me and you to break the chain. So don't forget to wear a mask, wash your hands, maintain social distancing and follow all the COVID-19 safety protocols. If you like this content, do give this video a big thumbs up and don't forget to subscribe to TV9 News on all the social media platforms. Thank you for watching and stay safe.